Welcome back to Grandma Needs Rehab. And in this episode, we talk about that thing. Yeah, syphilis. And most people know it's not a good thing, but at the same time, may not exactly be sure what it is or what it does to you. Particularly, we're going to talk about things like how it can cause a stroke. Yeah, most people didn't know that could do that. But yeah, sadly, it does. So if you ever wondered, or not really wondered, but now you're kind of curious, well, stay tuned and we'll ponder that. Before I start going on about syphilis, which is a sentence I didn't think I'd ever say, there are some things you should know. One, I am a medical doctor. I've been taking care of patients now in a hospital setting for about 20 years or more. I am board certified in internal medicine, and kind of everything we're going to talk about from here on out is, educational. It's made to talk about concepts and explain things a little bit. It's not medical advice, but if you do have any questions, concerns, issues, anything like that, please talk to your doctor. And otherwise, enjoy. So what actually is syphilis? Syphilis is an infection, and it's a sexually transmitted disease or sexually transmitted infection caused by this bacteria, a bacteria called Treponema pallidum, in case you were super interested. As kind of alluded to with the sexually transmitted thing, it is, sexually transmitted. That means you can pass it from one person to another based on any of the three major types of, sexual encounter. As you may have noticed, I did not go in depth into the three different major types of sexual activity that can increase your risk of sexually transmitted diseases. And yes, there are many, many, many types of sexual activity, but three of them in particular do increase your risk of sexually transmitted diseases. And I think most of us can pretty much figure out what those are. But after all, this is, it's a family show. In addition to sexually transmitting, actually, this type of bacteria, unfortunately, can also be transmitted through the placenta. So, it is possible for unborn babies to develop this type of infection. And yeah, sad, but true. What happens when you're exposed to syphilis? Well, usually in about 3 weeks average, but it can be between 10 and 90-ish days, but average of 3 weeks, you can get what we call primary syphilis. And again, the average is about 3 weeks. And what happens during that time is you get these painless sores called cankers. And yeah, I had to look up how to spell that, but it's a canker. And the canker is kind of like a painless fluid-filled, lesion. And usually forms on average 3 weeks, but it could be as early as 10 days. And again, could be technically as late as like 90 days. And inside that fluid-filled little lesion is a bunch of more bacteria just floating around waiting to, do stuff. So what happens if you do nothing with these cankers? I mean, they're painless. So, sometimes people don't seek attention because other than being there, it doesn't hurt or anything. Well, if you do nothing, it will kind of go away on its own. Yeah, like just gone. And a lot of times, while on average it takes about 3 weeks before it starts to show up, about 4 weeks or so after that, and a lot of times they just disappear and they're gone and they just don't seem to come back. And a lot of people at that point think, well, whatever it was, it's not a problem anymore because it's, gone. But unfortunately, that may not always be the case. Many times after about 6 to 8 weeks of exposure, from the time it was, exposed, people can develop secondary. And again, that's usually 6 to 8 weeks after exposure. You start to develop like symptoms, like all over symptoms. And the reason you develop that is because the bacteria that was, kind of hanging around in those little cankers, well, they start to spread and they start to go through your body, like kind of all over. And they start to cause problems like flu-like symptoms, like fevers, chills, myalgias, or just muscle aches, general just kind of feeling like crap. But there's also an associated rash, and that rash is usually on the hands and feet. Can also be on the trunk, but hands and feet. Not painful, but definitely a rash. And it's all often associated with kind of all that other stuff. So that's, again, about 6 to 8 weeks after exposure. Even though you did nothing at the beginning and everything kind of went away, now you're starting to have some other symptoms. And sadly, this can last for 1 year. Believe it or not. Yeah. Sometimes the symptoms come and go, but unfortunately that can last to up to a whole year, which, yeah, that would suck. So let's say we get through primary, where you get these little cankers and they go away. And then 6 to 8 weeks later, we get the other thing, which is the secondary rash, fevers, aches. And that kind of comes and goes for a while. It doesn't have to be a whole year, but let's suppose we do nothing. Or let's suppose, the fevers kind of go away and the aches go away by the time you go to the doctor. And just like, it's probably just a bug. And then we just, don't have any more problems. Well, then what happens? Well, if we do nothing, we can end up going from secondary to what we call latent. Latent, by definition, nothing happens. So, and this can last years. So this can be like a lifetime where people never get any further than that. In other words, they have an infection inside them that they never know about, doesn't cause any symptoms, and they can live their whole life like that. Again, by definition, no symptoms. Now, the problem comes in where a third of those people can develop tertiary syphilis, okay? Tertiary syphilis, unfortunately, is a problem, and it can cause all sorts of really bad things to happen. And again, only a third of the people that have this latent syphilis will go on to get tertiary syphilis. But by definition, tertiary syphilis is causing damage, and it's this bacteria that's been floating around for years and years is now causing damage primarily to the brain and to the spinal cord. So it's all bad. Most tertiary syphilis occurs at least after 10 years of latency, or basically this latent period is usually after 10 years before people start to develop symptoms from tertiary syphilis. And tertiary syphilis, it unfortunately can be fatal because the damage it can cause to the brain and the spinal cord. And what we see, unfortunately, is usually pretty significant. So what are the really bad things that syphilis can cause? Well, we talk about issues of the brain and the spinal cord, but we'll go over some other things in a second. It's not just brain and spinal cord. This bacteria has been floating around your bloodstream for a while, and it can actually cause heart problems and stuff like that too. But to start off with, it causes strokes. And yeah, when people come into the emergency room and they're having a stroke and we admit them to the hospital and we start treating them for stroke, we check for that, because if somebody has a stroke associated with syphilis, obviously we want to treat that in addition to other things that we would normally do for stroke, which for those that have already seen my video on stroke and such, just, I defer to that. But unfortunately, it can cause strokes or mini stroke type symptoms. It also can cause things like dementia. Sometimes grandma's becoming demented not because of, age. Sometimes we can develop dementia or dementia type symptoms because of long-standing syphilis, which is important because obviously we want to treat that. The concern about treating tertiary syphilis, by the way, is, and we'll talk about treatment in a minute, but the problem with this damage is that treating the syphilis at this point, often while it fixes the infection, many times does not fix the damage that occurred over that period of time, but it will prevent further damage from occurring. So it's still important to find it and fix it if we can. But in addition to things like strokes and dementia, it does cause cardiac issues. And one of the problems with cardiac stuff is that it causes inflammation of the blood vessels. And these inflammation of these blood vessels can lead to blockages or prevent blood flow from going to where it's supposed to. So can you get things like heart attacks from syphilis? And the answer is yeah, you can. Granted, there's diabetes, high blood pressure, all the things much more common, but at the same time, is it possible? And the answer is yes. You can also get inflammation of your heart in general that we call myocarditis. Myocarditis is literally inflammation of the muscle wall or the heart muscle itself. And unfortunately, that can also come from syphilis. Tertiary syphilis can lead to aneurysms, okay? Especially of the aorta. Aneurysm, so I don't spell it wrong on camera. Is that aortic? Yeah, aortic aneurysm, which obviously could be a big problem in the future. If those things weren't, bad enough, it can cause other stuff that's still bad, like psychiatric problems, like behavioral changes. People can have significant psychiatric events because of the effect that it has on your brain. It can cause personality disturbances. It can cause paranoia. It can all the, not good personality psychiatric things. We also have what we call motor dysfunctions, which is when it attaches or causes more of a problem with the spinal cord. And you can get something called tabes dorsalis. And tabes dorsalis is basically the posterior or back part of your spinal cord starts to degenerate because of an infection. It can affect how people are able to walk and how they're able to balance, or lack of balance for that matter. And again, caused by an infection, specifically damaging the back part of your spinal cord. In addition to all those other bad things, you can also have visual problems. You can have hearing problems because unfortunately it can cause deafness and blindness. And this is all from an infection that's been floating around there for many, many years and causing damage. And the problem with this type of infection is while we can treat it, and we can get rid of the infection, often the damage that was occurred by that infection does not get better. So how do we find it? When do we start looking for it and all the things? Well, a lot of times people have symptoms, and the symptoms often are what make us look for stuff. For example, if you have the canker, we have secondary, okay? When you get the fevers, okay, chills, the rash on the hands and feet. We start looking at people that have, weird stuff, like the myocarditis or inflammation of the heart muscle. A lot of times they have to do biopsies and stuff to actually determine that. But when people come in with some of these other strange symptoms, like, again, we talked about the young person with a stroke or the behavioral changes, all those things, a lot of times we just start with some blood work. And the two types of blood work that we often check is kind of like a screening process, is blood work called an RPR or a VRDL. And those are the blood tests that we would normally order, like in the emergency room or primary care office or something like that. And it's a screening test. Originally, I was going to talk about all the different types of blood work associated with syphilis and kind of like the confirmatory stuff and blah, 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 blah. But yeah, that was horribly boring. And the fact is, not really necessary, because when it comes right down to it, interpreting blood tests for syphilis and things like that, that's not something that most of us are probably going to do on a daily basis. I kind of do, but most of you probably don't. So what you do need to know is that there is a blood test to determine if you could potentially have syphilis. And I say potentially because if that's positive, then we do some other tests to kind of confirm it, okay? Sometimes people can have an active infection. Sometimes people have an infection that, is long gone and has been gone for years. Maybe they were treated with antibiotics for a different reason. If they had a sinus infection and were on penicillin, something. All you need to know is that, yes, we have blood tests, and yes, we have confirmatory blood tests, and no, you don't have to listen to me blab on about them any longer. So how do you treat it? Well, there you go. The three main antibiotics that we tend to use for syphilis. Penicillin, by far the most preferred, if possible, but there are people that are penicillin allergy, and if you do have an allergic reaction to penicillin, obviously we don't want to be giving you that. But doxycycline and tetracycline are the two alternatives that we often use. The problem, again, with treatment is we can cure it. We can get rid of it. This is an infection. So if we treat it appropriately with the appropriate antibiotics or antibiotic choices, we can make this bacteria go away. The downside to syphilis, not that there's an upside to syphilis, because there's not, but I guess my point is the problem with syphilis, in addition to all the other stuff that syphilis can do to you, is that treating the infection, unfortunately, does not resolve the damage that was already occurred, especially in tertiary syphilis. So if we do have long-term problems with syphilis, just fixing and killing that antibiotic or fixing and killing that bacteria will unfortunately not improve the behavioral changes. It usually does not improve the heart changes and things like that associated with that long-term infection. So that's my show for today. I hope everyone's learned a little bit about, syphilis and what it is and, why it's a bad thing to have. For all those worried about grandma, yeah, she's negative. And I'm not just talking about her overall, attitude towards life. I mean, her blood work was negative. Why did they test it? Because she had a mini stroke and they were worried about things like syphilis that can cause symptoms like that. But it was negative, which is good because no one really wanted to have that conversation with her anyway. But if you like this type of material, this medical stuff where we sit and talk about stuff and what it is and, what it does, like, subscribe, do all the things, and I'll get another video out to you as soon as I can.